Hi, my name is Claire Lewandowski. I work at Eagle County Environmental Health, and I'm the Environmental Health Manager here.
And hi, I'm Heath Harmon. I am the Director of Eagle County Public Health and Environment.
The policy we're talking about today is the Transfer of Title program for on-site wastewater treatment systems, also known as septics. The policy aims to protect public health and environment through an inspection program that would be required at the sale of a property.
When you're thinking about selling a property, there's so many inspections that happen already. And so adding the septic system as part of that inspection process just seems like a logical step. That way we're not passing on that problem to the new owner and we're able to correct any challenges that might exist. When there are challenges that are identified with a septic system, I think what we also will implement is a balanced practice as it relates to the timing of that repair, just making sure that we're not putting any community member out. I think that's the key, is with policy trying to balance equity in the needs of our community members while at the same time then getting the corrections that we need if a system is failing. There's a lot of steps when proposing a policy, and so one of the first steps that we took is actually bringing this to the attention of our Board of Health members. That's an important step just to get some guidance, some thoughts from them. We can talk about engagement. We can also talk about the timeline and when we'll bring that policy back for a more formal review. So that's always a key starting point for us.
Yeah, there's a lot of research and collaboration that goes into creating this policy, working closely with Colorado Department of Public Health and Environment, Water Quality Control Division on the minimal requirements is important. Also collaborating with other counties. There's 20 other counties currently in Colorado that have transfer of title programs, so we can learn a lot from what they've experienced already. After conducting research and stakeholder engagement, we're going to take those comments, concerns, and ideas, because this is a collaborative process, and put them into a draft policy that aligns with Regulation 43 minimum requirements. And then we will take that draft policy to the Board of Health and to our stakeholders to make sure everything aligns with our purpose, the purpose of our Board of Health, and philosophy, value systems in Eagle County and this program, the stakeholders' needs, and the federal and state laws.
I would also add this is a great opportunity in terms of collaboration with our community, because there's a lot of stakeholders. So whether that's going to be different water districts or if it's going to be our real estate community, there's a lot of folks that are going to be interested. So we can collaborate and get a lot of engagement from some of those stakeholders. And we'll also have a lot of additional internal folks that we'll collaborate with. So different departments could include our county attorney's office. It could include our community development department, as well as our assessor's office, and probably more. But nevertheless, there's always engagement, I think, internally as well as externally when you're looking at policy solutions.
We will continue to communicate the draft policy and take any concerns and edit the policy as needed, and then we'll bring it to the Board of Health for adoption.
So hopefully, as you've had a chance to hear about some of this policy as an example and adoption in the process, there's a lot of steps. And so we want to be thoughtful in terms of engagement with our community, with other stakeholders. It can take some time. This isn't something that you pass in just one meeting after one conversation with Board of Health members, but rather after multiple engagements with the community, with stakeholders, as well as our staff. So it takes a little bit of time, but at the end of it, you have a really good product. You have a new policy that can be adopted and ultimately is protecting, in this case, our environmental health.